I am Sonja LaBarbera, President and CEO of Gaylord Specialty Healthcare. It is an honor to have Senator Bluementhal and his staff with us this afternoon. Today is a great day for the future of rehabilitation medicine. I am pleased to announce that Gaylord has received $1.2 million in community project funding for Connecticut's first and only residency program in physical medicine and rehabilitation. This program will help address the critical shortage of physiatrists and will assist the nation's population of baby boomers to age in place, remain independent, and have improved quality of life. Our vision is to not only train the next generation of physiatrists, but to help transform the delivery of patient care for residents of Connecticut and beyond. Over the next 18 months, much of this floor will be transformed into our Center for Education, which will include dedicated space and technology for our residents, with areas for learning, collaboration, and innovation. I thank Senator Bluementhal for recognizing and supporting Gaylord's vision, which will contribute to the health of our state and our nation. Here with more details on our residency program is Dr. Steve Holland, our Chief Medical Officer.
Thank you, Sonja. Welcome, Senator. So I've been here at Gaylord for 10 years, which makes me a newbie still for most of the staff. But the idea and the hope of a residency program was here long before I arrived. What has become a dream, basically, and now a dream come true, is that we were able to partner with the University of Connecticut and Hartford Hospital to build this residency. And it will be a 4-year residency, 4 residents per year, to a total of 16 residents. The interest in the program has been staggering. We've had over 400 applicants for 4 positions, and we've interviewed over 100 candidates. And much to our surprise, we had 100% match for the 4 positions with our top-ranked candidates. So to me, and to the people in Connecticut academia, this is almost unheard of. For me, though, personally, it was really more fun than the NFL draft and March Madness combined. So we're deeply grateful, Senator, for your efforts in obtaining the funding necessary to renovate this area. And it's not only deeply appreciated, but we recognize our responsibility, and we pledge our plan to make this the finest physical medicine rehab residency in the country. And with that said, I'd like to introduce one of our physiatrists, also a faculty member, and also the director of our inpatient rehab division, Dr. Elisa Sicklick.
Thank you very much, Dr. Holland. As Steve mentioned, I am Dr. Elisa Sicklick. It has been my pleasure to be a physiatrist, a physical medicine and rehabilitation physician at Gaylord for nearly 30 years. Physiatry is a unique medical specialty that addresses function of the whole person, not just an organ system. On any given day, a physical medicine and rehabilitation specialist can see a wide range of patients, from weekend warriors with sports injuries, people who have suffered strokes, to survivors of the most catastrophic injuries resulting in spinal cord and traumatic brain injuries. Our goal is to help people with physical and cognitive impairments maximize their function and independence, and ultimately, quality of life. Having completed my residency in New York, before coming to Gaylord, I remember being struck by the lack of training opportunities for young physiatrists anywhere between New York and Massachusetts. Seeing this residency program come to fruition really does bring new hope to providing optimum care to people in Connecticut and beyond. Thank you so much, Senator Bluementhal, for all of your support.
30 years.
Yes. Yes.
I didn't know that 10-year-olds could get
I like you, Senator.
I'm just really inspired to be here. I've visited Gaylord on many occasions for many different reasons. sometimes to see friends who were here, and sometimes to meet with staff. And every time I come, I realize that you folks work miracles. This is a place where miracles happen. They may not look like miracles to you because you know how they happen, but to any of us who see people who come and leave, the before and after truly looks like a miracle. And this kind of medicine, physical medicine and rehabilitation, is one of the new frontiers. It is growing exponentially in importance, especially with COVID. I know people who have come here after COVID and who now are back to normal lives when seemingly they could never recover. And so I'm really excited and proud to be here today. The $1.2 million is a token of our investment and our tremendous confidence and trust in the great work that you will continue to do. The skilled professionals who work here are not only miracle workers, but they are truly givers of life. People who come here thinking they will never go back to a normal life and resume enjoying all the things they did before, truly are grateful to you, but so are their families, their communities, and all of us who are admirers and fans of the great work that you do. I am really excited to be standing in a space that I think is going to be renovated. Sonja has told me, but I just want to give a great big thanks to the docs, the staff, the nurses, everyone who works here. And it's really a tribute to Wallingford as well as Connecticut that we have this resource. When people tell me that they are coming to Gaylord, I think, number one, they really need help. It's serious. And number two, they're going to the best place in the whole country, probably in the whole world, to thank you all. I look forward to coming back and celebrating, the residency, and most important, celebrating the work that you're going to do with this new facility. And I urge everyone and anyone who is impressed by that work to contribute, to support Gaylord, to make sure that this great institution is available to as many people as possible, because there are a lot of people who could benefit by it and who simply can't be here. And this place is truly life-changing for so many people. So thank you again. Keep up the great work. Thank you.
Thank you.